Thank you, Commissioners. Thank you for the opportunity to address you and the community as a whole. I want to take this opportunity to praise our Emergency Operations Center and our extended community partners. They have been invaluable for the last 4 months as we face this crisis as a community. They have been steadfast and they have been resolute in assisting the health department and advancing the health of the community. Last Friday, we started stage 2 of the Governor's Road to Recovery. At this point, more businesses are open than are closed. Restrictions remain for indoor dining, gyms, theaters, youth camps, and daycare centers. Those that are open face necessary practices such as social distancing and sanitization that impedes some of their efficiency and profitability. Tolerance for public health restrictions and law enforcement action is very low. Our citizens are ready for the freedom to evaluate their own risk. Since I last spoke, positivity rates are a new important metric to watch from the public health dimension. This represents the percentage of residents who have tested positive out of everyone who was tested. It's a rolling 7-day average. Positivity is the gauge by which we can better evaluate the presence of the virus in our community. The higher the number, the higher the prevalence of the virus. So how does that apply to Kent County? Kent's positivity rate at 11.1% is the second highest in the state with an overall average of 7.4. So the virus is very much active in our community, and even new cases, even though new cases and hospitalizations are down. Community spread of the virus is outpacing nursing homes or other outbreaks. In the last 2 weeks, we have seen more than twice the number of new cases attributable to community spread as compared to congregant facilities. Community spread has disproportionately impacted the Spanish-speaking community in the last 2 weeks. We have not linked any of the new cases with a single employer or an organization at this point, but it has affected several extended family groups. This included our first pediatric cases last week. Large gatherings should continue to be discouraged. This is especially true for events where crowd size cannot be controlled or the ability to socially distance is constrained. As we reopen, the health department seeks to set the example on best practices and being a resource for those who wish to do the same. We are open to field questions and relay whatever the current guidance is from the experts on matters related to COVID-19. As a practical matter, the health department hotline has been deactivated. Our Emergency Operations Center has reduced its meetings from 5 days a week down to 3 days a week. At this point, I want to just give a brief overview of some of our numbers, as I usually do, talk about the pillars of recovery and some of the health department's reopening plans. At this point, as of June 7th, we have 187 total cases. This is an increase of 32 since we last met. Of those 32, 9 were in nursing homes and 23 were related to community spread. The Kent County number of deaths currently stands at 19, attributable to COVID-19. This is an increase of 5 since the last report. 4 were in nursing homes and 1 was community related. The total number of people that we have tested is citizens in Kent County, 1,222. Our testing rate is 6.3% of our population. This is 7th highest in the state. At this point, 5 of our 7 zip codes now have enough cases to show data in the state's COVID map. The only 2 that still don't have enough are 21645 and 21650. I'm not sure which ones those are, by towns, but those are we don't have enough cases there yet. As it relates to let me talk about our outbreaks in the nursing homes, and this is as of yesterday, June 7th, Autumn Lake, that started on April 14th, and all cases have resolved except 1 staff member who still has symptoms. At this point, we are on the cusp of, wrapping that up as an outbreak entirely. The resorts at Chester River Manor still continues to have, ongoing spread. At this point, they've had 52 positive cases. This is an increase of 12 since the last time we spoke. 39 were residents, 13 are employees, and there have been 4 deaths. Heron Point, also had, there was a single employee who was reported yesterday as being positive, and in the long-term care community, a single case is considered an outbreak. So we're working with them to track that employee and any of the other folks who have come in contact with them. On to the 4 pillars. Our personal protective equipment. The PPE supplies in the county have stabilized. Light demand due to an increasing available supply chain has allowed the health department and the emergency operations center to build a stockpile of PPE for future surges. We also expect an additional delivery from the emergency management agency this week, so that will add to the supply that we have. One of the biggest changes since we last met involves community testing. We were doing a regional approach down at Chesapeake College. Starting yesterday, the Kent County Health Department is providing testing in the county at the county roads building. That is available by appointment. No physician order is required, no cost. Out-of-pocket cost is required for those being tested. We're open Mondays and Wednesdays from 9 until 12. If you want an appointment, please call the main health department number at 410-778-1350. We have translating services are available on site through our language line telephone service. We expect the volume at our testing sites for the 2 days to be between 60 and 100 per week. Yesterday we had 43 individuals who were tested, and we're hoping to get those results back in 2 to 3 days. If our volume drops or if it's below what we're expecting, we will drop the requirements for an appointment. We will open it up to whoever is available, who wants it, and we won't, at this point we're trying to restrict it to Kent County residents so that we're not overwhelmed. What has happened in other jurisdictions, when they have done on-demand testing, it becomes sort of a free-for-all, and we're trying to avoid that problem by using appointments. But we're excited about this. So let me talk about our longer-term testing strategy at this point. We had anticipated doing community testing for about a month, and the health department was hoping that the private sector and the commercial sector would pick up community testing, on-demand testing as part of their regular business practices. We have found that that is not the case. The University of Maryland Shore Regional Health has declined to provide any meaningful community testing in the community. They will only test hospital patients or those citizens who are already members of their primary care practice. And that leaves a large swath of the county out of the loop there. LabCorp also has declined to perform specimen collection. No pharmacies in the county are willing to provide testing. So the health department will need to offer community testing for the foreseeable future. our plan at this point is to extend what we're doing. What we want to do is to reallocate some of the public health cares funding to hire a testing team, a 6-person testing team that can perform testing 2 to 3 days a week through December. The estimated cost for that will be about $23,000 a month. We're going to have that plan hopefully in place by early July so that we do not skip a beat with providing testing to the community, and we have that resource available for all who seek it. The health department also stands ready not only for on-demand testing, that we want to be available to investigate outbreak situations as they come up, or do underserved areas of the county that we identify with the positivity rates. I'm happy to report that we have tested all of the detention center employees and all of the nursing home residents and employees, and the detention center came out, all the employees, all were negative, which is good news. Hospital surge capability, as the statewide numbers indicate, not only are the number of new cases declining, the number of hospitalizations have declined. They're down both locally and statewide. At this point, my understanding is Shore Regional Health is operating within their normal capacity. They haven't needed to tap their surge capabilities. And the good news is that Shore Health now has ICU vacancies in their regular capacity, which was not the case the last time we spoke. Contact tracing is one of the other pillars. The statewide call center went live on 6/5. The health department also went live with the new IT system on last Friday. We are interested in, we're in the process of finalizing hiring 2 additional contact tracers. We still see through contact tracing that most of the positive cases are coming through occupational exposure or household transmission. I do want to mention the CARES funding, since we are partners in getting that funding out to the community. The health department has received its first batches of invoices for payment from the county, and I think that includes the hazard pay that you approved last week. We are going to process them accordingly. I think we still need to have an information session for our recipients and stakeholders so they understand what is appropriate and what is not appropriate. So before they come to you, that will help speed the time you have to spend on approval discussions. We're still looking to prioritize the high-cost projects that will require procurement lead times, because we have to have this money spent by December 30th. I want to, at this point, pivot briefly to the health department's reopening plans. At this point, I'm expecting the state government to open up, to move to open its, all of its operations sometime in the next 7 to 10 days. We have received notice from the Department of Personnel Management that they will give us approximately a week's lead time, to get everything ready. We've been working on the planning stages, for at least the last month about how we're going to do that and still provide our existing services to the customer. We're excited about getting back to normal, getting back to doing the things that we were doing before, and having COVID take a back seat. That will be good. As far as the AF Whitsitt Center goes, we plan to reopen that on June 29th. We're going to open in a limited capacity and expand processes as it becomes fine-tuned with our ability to handle the COVID requirements, the isolation, the quarantine, the testing. These are all unknowns that are very important to control in a residential setting, especially where you have folks who may have substance use disorder issues along with medical issues. As far as opioid treatment funding, I expect that, if everybody at home could put their phone on mute, thank you. I expect opioid funding, and generally, the state projected revenues for the year are down substantially. I expect that there will be reductions in opioid funding moving forward into next year, and we're interested in positioning the Whitsitt Center to be self-sustaining without grant funding long into the future. We want to be self-sustaining through our regular insurance billing practices. At this point, because we have been closed for 3 months, the center faces a significant deficit that we are going to carry over to the next year, and we're going to have to figure out a way to pay that off. At this point, we are also considering the mental health crisis beds that were part of the Whitsitt Center. As we look at those specific beds, the funding that's available through the existing grant does not come close to covering those costs. Additionally, other programs that are facing an uncertain future are medical adult daycare. The program, involves our citizens who are at the highest risk for COVID-19. These are folks who have medical issues, who are older, and who, if they got infected, would likely have a very serious case of the disease, and it's a significant problem. It would be a significant problem for them. Our adult daycare physical space cannot support adequate social distancing and have enough consumers to break even. We're looking at continuing remote services as we have during the state of emergency, and resumption of in-person service really will depend on whether we have better treatment or vaccination for the virus. Our school dental program is also facing an uncertain future. That's because we have to provide services and bill Medicaid for that, and we do not know what our school operations are going to look like in the fall. So we're considering that, and we have 2 employees who are potentially affected there. In closing, reopening will continue. I anticipate, as I said, the operations of regular, state government offices, to come back online in a week or 10 days. I urge all to continue with their vigilance, with face coverings, social distancing, and hand washing. Personal responsibility will determine the pacing and success of reopening. Reopening does not mean that COVID-19 is behind us. I encourage all not to become complacent with the practices that have kept us safe. I think we're moving into a stage where everybody, all of our citizens are going to be asked to make their own risk assessment about the actions that they're involved with related to infection control. And I'm urging our citizens to be responsible and evaluate their risk, because that is what's going to keep the community healthy moving forward. The Kent County Health Department is committed to serving our citizens as we navigate this new chapter of the crisis. Thank you.
Thank you, Mr. Webb. Any questions?
I have a question. People who are making appointments to be tested, is there a criteria for that? Like, do they have to show symptoms, or?
No. Anybody, if you want a test, and the only requirement is that you make an appointment, and at this point we ask that you be a Kent County citizen, because we do only have approximately 100 tests a week, and we want to make sure that we address the needs of our community first.
I always debate why people should get a test and why they shouldn't if they don't show symptoms. But I guess that's just up to individual choice.
That, if you've been exposed, if you think you're, if you don't have a doctor or you don't know what your status is, it's better to be tested and be negative than, potentially, not have symptoms and be transmitting it. So if, you have a family member at home, if you have come into contact with someone who has since tested positive that you've learned about, that's why we're here. We want to make sure that if you think there's a risk, that you have the resources to get the information you need.
Would that be, and you correct me, I mean, I may be wrong on this, but if you were to get tested today, say because you thought you were in contact with someone, and you tested negative, is it possible if you got tested 5 days later, you could be positive?
Correct. So that's, a negative test just says you're negative at that moment in time. That you could have been exposed and not developed enough virus and be positive and be what's called a false negative, where you've been infected but the virus hasn't had a chance to build up in your system to generate a positive test.